Welcome, everyone. The webcast is about to begin. Please note, today's call is being recorded. Please stand by.
Welcome, everyone. Five Wishes is pleased to present today's webinar, Who's Driving? Ensuring Patient and Family Involvement in Advanced Care Planning. My name is Jennifer, and it's my pleasure to facilitate. We are recording the call, and we did mute all participant lines. If you need help, please email 5wishes@compartners.com or send us a message in the chat box. If you're listening over the phone, you may press *0 for the operator. This presentation will last up to 60 minutes, and you're encouraged to ask questions throughout. Please submit your question by typing it into the chat box in the lower left corner of your screen, and do be sure to click the Send button. Also take a look at the links box located above the chat area. Here are resources that you may view, save, or print. Simply click on the link of your choice, and a separate window will open. This will not interfere with your viewing of the program. It's now my pleasure to introduce Paul Malley. Paul is the president of Aging with Dignity, a position he's held for 18 years. With more than 20 years of experience in the field of aging and advanced care planning, Paul is a national expert, frequent speaker, and advocate for quality and dignified care at the end of life. Paul, welcome. I'll turn it over to you.
Thank you, Jennifer, and welcome to everyone joining us for this presentation. We're really excited to welcome you and to know that there are a few hundred of you that registered for this webinar. You represent all types of healthcare organizations and professions from all parts of the country. So welcome. We're glad you're here, and we're really grateful for your participation, especially in this webinar because the topic is so important to us, and even more important, that it's important to the people we all serve. There's been a lot of change in advanced care planning over the years and the way we go about advanced care planning. Some of it's very good, and some of it, honestly, is a little bit concerning. At Aging with Dignity, our mission is to safeguard human dignity, to make sure every person knows, feels, and understands that their dignity, their worth, and their values, and the value of their human dignity are maintained even during times of serious illness or disability. Advanced care planning, when done well, can be a wonderful way to affirm a person's human dignity. But here's the important question. Who's leading or driving the process? It's always important to revisit the question, who's the process serving and who's at the center? The Five Wishes mission is all about preserving humanity and the whole healthcare experience. And that means everyone's humanity, most certainly patients and families, and also healthcare professionals, you, both the servants and those who are served. I think if we all had to rattle off the list of changes in the current environment, we could probably come up with a big list. And patients and families could also probably come up with a big list. And there might be some things that are similar on both lists. And when it comes to challenges, could be brief visits or high caseloads or bottom line drivers or automation or interoperability or electronic health records. Patients and families and caregivers wonder, I think, if they're known or anonymous. And healthcare providers, I think, want to know who their patients are and what's important to them so that they can give them the best care possible. I think from what we've seen, healthcare providers are uniquely positioned, especially well positioned, to foster these principles of human dignity, of letting a person know that they are not anonymous or unknown, that they are in fact known, that healthcare providers really are on the front lines, the first responders, so to speak, when it comes to issues of humanity and human dignity. We also see that advanced care planning in particular can support dignity and humanity. At its core, advanced care planning is about asking a person, what's most important to you while you're here in our care and when you leave here? What do you want and you need when you're most vulnerable? Who are you and how does that shape what you want? and then having these answers shape the care that is delivered. So that's what we can unpack if we do advanced care planning well. If it's something that's not just a checkbox to be checked or a compliance issue to be addressed, it really can be the best opportunity for you and your team to do some of the most important work that probably brought you into healthcare to begin with. So I'm happy to turn it over now to Kathleen Taylor, our Five Wishes Healthcare Advisor. And many of you might know, if you've participated in these webinars before, that Kathleen brings over about 30 years of experience, both at the clinical side, at the bedside, as well as in administration and healthcare. And she has helped us and all of our partner organizations create the framework for advanced care planning that works well. Kathleen, turn it over to you.
Thank you, Paul. That was a wonderful introduction to our topic today, and I thank you for the nice introduction of me as well. Just as a reminder, we are so grateful for all of you participating in the webinar today and in our Five Wishes practice community. If that's a surprise to you to hear, I want to make sure that you understand that the Five Wishes practice community is a collaborative community of everyone who's using Five Wishes tools, any components of the Five Wishes program for advanced care planning. So you're all here together as clinicians or program advisors or whatever your role is in healthcare organizations because you use components of the Five Wishes program. And the whole idea is for us to give you additional resources to ensure your success and help you share with each other best practices. So keep that in mind. There are links in the sidebar to the Five Wishes practice community page and for some more information about the Five Wishes program for healthcare. So with that said, let's get right into it. Today's focus, as Paul was wonderfully outlining for us, we're going to discuss some conceptual frameworks that can help you consider your organization's advanced care planning programs, and you may see this abbreviated as ACP on some of these slides, to consider your program's activities and encounters from the perspective of the person served, who we're going to refer to mostly as patient today for the sake of simplicity. And we're doing this because sometimes our own organizational processes and efficiencies that we create can cause things to feel for the person served, for the patient, like what we're doing is saying, we welcome you to this program that we built, instead of it feeling like we built this program for you. We built this program with you in mind. So that's what we're trying to get at through these different conceptual frameworks we will consider today, and hopefully these will help to ensure that what you're doing is really designed around the folks that you serve. I will ask you, please, we want to hear from you. If you have questions or comments as we go through the content, just submit those into the chat box and click on send, and we will address those as we can and as we go through the day. So these concepts that you see here, patient-centered care, patient engagement, and patient experience, are all terms and concepts that you're probably familiar with, and they're likely the headings under which many of your process improvement, quality improvement, and strategic projects in your organizations fall. We're going to review each of these frameworks today, define them, and consider the factors and principles of each, and use these as critical lenses to view your advanced care planning work. As we do this, what I am going to keep reminding us to consider are these three things: people, processes, and tools. And to be clear about what these are, processes are the steps that happen for any person to receive advanced care planning information or to engage in activities, things like how a patient might be identified or flagged as appropriate for an advanced care planning conversation, and what steps they go through to schedule an appointment or request information. The process is as experienced by the person served. People are the interactions that patients have with anyone and everyone involved in those advanced care planning processes. So patients might interact with a scheduling person, with a case manager who suggests advanced care planning services, with a nurse, social worker, chaplain, whoever facilitates advanced care planning conversations. Maybe it's an intake clinician. It's every personal interaction along the way of the advanced care planning journey. Tools are the things with or the things through which people interact or complete these processes. And these can include anything from your advanced directive forms to an informational web page to your electronic health record, mobile apps, a patient portal, educational materials, etc., all of that. So processes, people, and tools work together. And this is truly a weakest link kind of arrangement. You can have fantastic tools, but if your people are lacking, that's going to matter more. You can have excellent and well-trained and skilled people, but if the processes are cumbersome or incomplete, then that's going to be frustrating. So all of these are crucial to ensuring effectiveness and success of your advanced care planning efforts. And most organizations will focus intensely on one of these. They get really into training or they get really into spending a lot of money on tools. But if you don't have the balance of the others, then there's a weakening of the effectiveness of the program. So as we go through all of these lenses, we're going to think about all three of these things. The first framework for us to consider is patient-centered care. The Institute of Medicine defines patient-centered care as providing care that is respectful of and responsive to individual patient preferences, needs, and values, and ensuring that patient values guide all clinical decisions. And I love that it says all clinical decisions on this definition. So that could not be clearer to me about what patient-centered care means. So let's break this down a little bit further into some core principles of patient-centered care. And these are adapted from Picker's principles. And these Picker's principles came from some researchers from Harvard Medical School on behalf of the Picker Institute and the Commonwealth Fund, defined several primary dimensions of patient-centered care, and those dimensions as they define them are known as the Picker's principles of patient-centered care. And that's what you see on the slide is adapted from those. So let's walk through each of these a little bit. Access, I'm sure that's got its own connotation for you, but just to clarify, that includes everything from awareness that the service exists, awareness that there even is advanced care planning service, availability of advanced care planning, and any adjustments or accommodations that are necessary to make advanced care planning usable and useful to this person being served. So access is a big concept, a big principle of patient-centered care. Respect for patients' values, preferences, and expressed needs. That involves patients in decision-making, recognizing that they are individuals with their own unique values and preferences, and of course treating patients with dignity, respect, and sensitivity to their cultural values and autonomy. And this is advanced care planning, I think, to its core. Patient preferences should always be considered when determining the best course of action for that person. The expertise and authority of practitioners complements and enhances patient perspective, and we'll talk about shared decision-making a little bit later. But the idea is that everyone's on the same team, including the patient, working toward the same goal, which is the patient's goal. Education and information involves providing complete information to patients regarding their clinical status, their prognosis, their progress, the processes of care, and information to help ensure their ability to participate in their own care and to thoughtfully consider decisions about it. Physical comfort, no surprise that that's part of patient-centered care. That, of course, means addressing patients' physical comfort in our context as part of advanced care planning, which is not often considered. But that's going to come up, especially with regard to pain management and support with activities of daily living as an element of people's perceived dignity, privacy, cleanliness, things that make people feel comfortable, and accessibility for visits. So physical comfort is, all of these are important, but that's one that gets overlooked sometimes. It is in the 5 wishes framework on wish 3, just to be clear about that. Emotional support and alleviation of fear and anxiety involves helping to alleviate, of course, fear and anxieties for the person, because they might be experiencing those with respect to end-of-life issues. Advanced care planning is an end-of-life conversation, whether that's hypothetical or we know that's coming. And people may have fear and anxiety around their own decline or the impact of the illness they have or their death on others, their family and their caregivers, etc. Involvement of family and friends, acknowledging and respecting the role of the person's family and friends in their healthcare experience, and educating patients and families on the role of healthcare agents and respecting the role of the person's healthcare agent in decision making. So patient-centered advanced care planning offers opportunities to learn more about the whole picture of a person's life, including the people who are involved with them and who in their life can provide the kind of support that the team might not be able to provide. So as we think about those considerations, what I've done with some of these slides is try to give you a way that you can walk through your own processes and have some questions to ask yourself about your advanced care planning program. So with those factors of patient-centered care in mind, you can ask yourself about access. Are simple, clear, accurate advanced care planning information materials and resources available to all patients? All patients, not just the ones who are seriously ill, but all of them across the care continuum. Are the materials clear to people regardless of their health literacy? Are they clear to people regardless of their reading level? Are they available in a variety of settings across the care continuum? Are they available in different languages? Is advanced care planning information available or presented in the patient's own community from trusted sources? So those are addressed by things like a speakers bureau that can go out and do community presentations, outreach partnerships with faith communities or other trusted resources for communities. That taps into the awareness that it even exists. Are accommodations available? And accommodations can be accommodating for technology access. A lot of advanced care planning conversations are held over telemedicine now. Are you looking at access to those resources and how is that addressed? Teaching about using those resources. Accommodations for language barriers, modifications for vision or hearing impairment, modifications for literacy level, those kinds of access questions. And then again, just thinking about how do people even become aware that advanced care planning exists. The next area, respect for patients' values, preferences, and expressed needs. How are patient values and needs elicited, and how are they recorded in a way that fully reflects the person? This is always interesting to me because when you look at electronic health records, if you go into Epic or Cerner and you click on advanced care planning tabs or wherever it's located, if it's on some other drop-down, what's interesting to me is it usually shows up as, yes, we have it, no, we don't. And you have to go to some trouble to really find the actual advanced directive documents, and then even more trouble to read them. And if there are notes about the conversation, those are not often attached in a way where you're going to readily find the information about here's what happened during the conversation. That's a challenge to think about. That's a tool-related challenge to think about in terms of if we're really respecting patients' values, preferences, and expressed needs, how do you know what they are? How do they actually drive the care as it's delivered? And I don't know how to solve that except for us to be mindful of it and continue to find ways that we make sure the team who's treating someone does look at, here's what happened in this conversation. And that can only help care concordance and making sure that we're helping people feel like what you said to us is understood. Education and information. How do patients learn about the benefits and the processes of advanced care planning? Does the advanced care planning process ensure that patients with serious illness are offered clinical information to help in their decision making? And how does that happen? How does the advanced care planning process promote referral to clinical experts who are familiar with the patient's likely complications in their condition and their prognosis if that comes up during a conversation with a seriously ill person? Physical comfort, we talked about that some as we went over the principles. And while that's not an advanced directive care decision, it always affects those decisions. People's concerns about symptoms, about how they're going to be able to breathe, if they will feel pain or hunger, those concerns affect the decisions that they make in advanced directives, which is part of advanced care planning. So does the conversation address physical comfort? And what adds to this person's sense of comfort at the end of life? Emotional support. Similarly, most advanced directive decisions are made because people, they have in mind the kind of experience that they either do want or that they don't want. And that's almost always based on some direct or indirect personal experiences with other people who have died. So they do or they don't want to die like their wife did, or their sister or brother, aunt, or friend. So it's important to explore fears and anxieties as part of the advanced care planning process and ensure that you're alleviating those with information if that's appropriate. One example of this particular item is my grandmother had heart failure and repeatedly developed pneumonia and was put on a vent several times, which at the time to me, since I was the hospice lady, was rather confounding because we'd had many conversations about this. But here's what I learned in the conversation. When my grandmother was 8, she found her mother's body on the floor in their kitchen. And then when she was in her 60s, she found her husband's body. She did not want anyone in her family to find her dead body in her home, so she wanted to be hospitalized. And furthermore, every time I put her on a vent, of course she couldn't remember anything about it, and she would wake up and she'd be able to interact with her family and friends. So to her, that was a positive. And her directed decisions were, yes, put me on event as many times as you can. Just put me on that. I like that. That keeps me going. Now, there was a lot of information to give her about that, but it wasn't an invalid decision. She's allowed to choose that, and she definitely had her reasons, and we wouldn't have known if we hadn't really deeply explored those fears and anxieties and how she arrived at some of these decisions. Involvement of family and friends. In what ways are patients empowered to involve their family and their friends in their advanced care planning decisions? And how are healthcare agents or potential agents informed about and supported in their role? Okay, the next area that we're going to consider is patient engagement. Health Affairs defines patient engagement as a concept that combines a patient's knowledge, skills, ability, and willingness to manage their own health with interventions designed to increase activation and promote positive patient behavior, such as obtaining preventive care or exercising regularly. In other words, the patient is willing and able to participate in their care, and someone, i.e. the provider, is providing interventions to promote that participation. Insurers and payers are particularly focused on patient engagement because when people are actively involved in their own health and wellness and decision making, it typically results in better outcomes and lowers the cost of care, which is fine. It also typically results in people making decisions that are more in line with their own values. So being engaged, patient engagement, suggests involvement in some sort of action or activity. The patient engagement requires activity on part of the patient. So that leads us to these factors in patient engagement. The first one, which is just that, patient activation, the patient taking action. It means that patients are continually invited to become involved through a variety of means. Shared decision-making, as you all know, is of course when treatment decisions are made based on patients' stated preferences combined with medical evidence and clinical judgment. And it's making sure that those that clinical judgment and doesn't outweigh patient-stated preferences. It's shared decision-making. And inclusion is a way of including patient perspectives and the patient voice in organizational decisions and process improvements. So these kind of build on each other. They actually go, I think, to higher levels when you think about what inclusion means. That's really driving the development of programs based on patients' input. So things to think about with patient engagement. Patient activation. What are the actions in your advanced care planning program for patients to take? And how do you know when and if they've taken them? How are they presented to people? And what makes it easier for patients to take action? In what ways and by whom are patients continually invited to share their care preferences, to share their care preferences and have them become part of the care plan? Are they effectively involved in expressing and communicating their preferences? Patient engagement, patient activation is one of the areas where tools are really important to consider. Things like patient portals or secure online sites that allow people to access their advanced directives, view them, edit them, download them, share them with other people, and communicate with their health provider through that portal. Those are great tools to improve patient activation and make it easier. Reminder, advanced care planning revisitation reminders. It's been 5 years. It's time for us to look at to talk about advanced care planning again. Or you've reached this milestone or this change in your condition. So reminders are another way to help activate patients. And patient education that includes suggested language is tremendously helpful. Anything that gives people phrases to use, that outlines specific steps to take. Do this after you complete the document. Have this conversation as you consider these choices. Those kinds of tools can really assist in patient activation. So as you consider that, think a lot about tools in addition to processes and people. Shared decision making. For that, you want to consider in what ways patients and clinicians really work together on advanced care planning. And again, how is medical expertise and clinical judgment shared while respecting patient choice? How do advanced care plannings take all of this information into account? How do you ask people during the advanced care planning process what they know and understand about their condition, and then offer information appropriately, fill in understanding gaps, again, where appropriate. These are all key elements in shared decision making, and they require skilled conversation. So this is kind of a people-heavy area where you want to consider the training of your folks in having these conversations and in referring to other experts. And in this area, we want to also consider how do patients even request information. And that's information about their condition, about advanced care planning processes, about any of their concerns. And inclusion. How is feedback or input about the advanced care planning experience gathered from your patients and families, or is it gathered? I'm not sure that a lot of us are doing that. How does feedback shape the advanced care planning program? And inclusion can be helped, again, by some processes and tools. Organizational decisions and processes can be influenced by patient voices through things like surveys or patient advisories, focus groups that include patients or people who have been served by the program. There are lots of ways to get patient representation that are a little bit more on the tools and processes side. So consider some of those for inclusion, because that can vastly improve your advanced care planning program. And the third lens or construct for us to consider advanced care planning through is patient experience. And I like this Barrel Institute definition. They say patient experience is the sum of all interactions shaped by an organization's culture that influence patient perceptions across the continuum of care. I like this definition, and I want to tell you why. The term patient experience, I'm doing air quotes right now, has, I think rather unfortunately, become synonymous with measures, with surveys. Patient experience is thought of like surveys like CAHPS. And those are measures that are based on asking patients whether something that should have happened in a healthcare setting, such as clear communication, actually happened and how consistently it happened. These are aspects of patient experience that are important to them, of course, and they're really the only source of information for did it happen and how often did it happen. But for today, we're going to kind of reclaim this term and reassociate it, not just with patient experience measures, those are important, but I'd like to blow this up and think about the full experience of care that the people you serve have. So the Barrel Institute definition, I think, is helpful in thinking past patient experience measures and into a fuller understanding of that. Patient experience and understanding it is really a key factor in moving toward the first area we talked about, patient-centered care. And by looking at various aspects of patient experience, we can really consider the extent to which the people we serve are receiving advanced care planning that's respectful of and responsive to their individuality and their own preferences and needs and values. So here are some cultural factors. Since the Barrel Institute defined this really as kind of the sum of the culture, they also have, I mean, I'm not advertising for it, but they've got a great program, apparently, their Patient Experience 101 program, and this is taken from the outline for the Barrel Institute's Patient 101 program. And it's a comprehensive learning package that's got things that you'd want to learn to increase patient experience education within your organization. And since culture is so important in patient experience, let's look at some of these cultural factors. One of them is building awareness, and that's among your organizational staff. Awareness of the reasons for caring about the patient experience and the value of delivering patient experience excellence. And in our case, that's specifically around advanced care planning. Increasing the motivation, and anybody who's found an advanced care planning champion knows that that is absolutely true, that personal and professional experiences are a huge motivator for people becoming champions, motivated to create excellence in advanced care planning. Developing knowledge and skills, having training that really addresses the competencies required to have advanced care planning conversations in a way that address all the things that we've talked about so far. Practicing skills in a safe environment. Nobody likes role plays, but they really do work, and it is a safe environment where you can go ahead and make mistakes while you're learning about how to have what for a lot of people is not a naturally comfortable conversation. And then preparing for usage on the job, using realistic scenarios and providing opportunities to reinforce key messages. So it's not just a one-and-done training, but there's ongoing support so that people can use those skills on the job. So those are cultural patient experience factors on the side of your organization's culture. And in addition, I want us to consider patient experience factors as perceived by the patient and person served. And those are feeling understood. When people have the opportunity to share whole person information about themselves and they feel like the team knows them, that is huge in improving patient experience. The convenience of processes and interactions for the patient, not for the organization, but the convenience for the person who's using those processes and tools and interactions. Atmosphere, while that's certainly physical setting in which advanced care planning interactions can take place, it's also just the feeling, the cultural feeling that encourages security and trust and confidence. And transparency. When someone knows what you're doing and why, and what is happening and what's going to happen next, that's transparency. And hopefully organizations have that with everything from treatment choices to billing. But with advanced care planning, it's really important to have lots of focus on transparency so people understand what this is and why are we talking about it and how does it benefit you. And this is about you. So with those in mind, again, and these are just little tickler questions to ask yourself. You can shape these questions in any way that you would like under these headings. These are just ones that we came up with for today. And again, the patient experience considerations, we're trying to get to a feeling of we created this for you rather than we created this, do you want it? So with that in mind, culture, considerations for that might be in what ways do you build awareness and motivation around advanced care planning, as we discussed? How do team members develop in-depth advanced care planning knowledge and skills? What's your training protocol for that? How's it reinforced? What opportunities do staff have to practice their skills and prepare in safe, realistic scenarios? That's an often overlooked part of training programs. Convenience. How are the advanced care planning processes and interactions and tools developed and used to be convenient for patients? Does the form follow function? Are there parts of the process that exist only for the convenience of the organization at the cost of convenience for the patient? This reminds me, I went to an orthopedic surgeon last week, and before I went, they sent me a link to their Freesia intake app and said, please pre-register for your appointment. I did that. I filled out a bunch of demographic information. I got to the office and they handed me an actual piece of paper on which I filled out some demographic information. And then they gave me another document on which I filled out some demographic information. And then they gave me a third agreement on which I filled out some demographic information. So what I noticed was, I get what's happening. These are all different systems, but they asked me the same stuff at least 3 times. And it was because they had systems where they needed it in these different ways, but it sure wasn't convenient for me, the person being served. Now, it didn't bother me that much, and I just kind of used it as an interesting example. But imagine if you didn't have the energy for that. And imagine if we're doing that with advanced care planning, which is kind of a difficult topic for a lot of people to even address. And what if they ask for it and we make it inconvenient? That's something that we really want to think about with tools and processes and people. Feeling understood. What opportunities are offered for patients to share, again, their whole person information? Who am I really? What's my story? And how is this information shared with the team who serves the patient? What systemic follow-through exists so that patients know that they're understood? And what I mean by that is, if I'm the one that has a conversation with this patient and then they need to go see you for a different part of care, how do you have some information, enough information about what we talked about that's relevant to this person, that you can receive them and make sure they know you understand who they are? How do we make sure they know the team gets them? Transparency. It's important for people to know what you are doing and why, and to have processes in place and people in place who can explain that. How are patients informed about advanced care planning processes and how their information is used and who has access to it? It's their business. How does the advanced care planning process ensure that patients are informed about their condition and resources for symptom management? And again, that's as much information as they want, but how are they offered it? And how is that, even though that's not part of the advanced directive choices, it should always be part of the advanced care planning conversation. And atmosphere. And you may not think that that is something connected with advanced care planning, but it really is. As as more and more conversations are being held over telemedicine channels, there's an atmosphere in providing care over telemedicine. It's really important to make sure that distractions are eliminated for the patient so that the setting encourages security and trust and confidence. Can the patients complete advanced care planning conversations in the comfort of their own home? And how are they empowered to do that? What kind of tools and processes empower them to do that? And we want them to have advanced care planning conversations in the comfort of their home, because that's probably where the people who matter the most in terms of knowing what they want are located. We want to facilitate and help with that, but we definitely want people to talk over the kitchen table or in the backyard and in settings that are most comfortable to them. And then for atmosphere, is there ample time and attention during facilitation? I know we don't always have time, and you can do these very quickly, but are there resources that feel to the patient and the family like, you know, we're really focused on you right now, and as much as you need to ask during this conversation, we'll either get to it now or we'll set up a second time to meet. So that's part of creating an atmosphere that improves the patient experience. One way that you can consider all of the things that we've been talking about today is through experience mapping or empathy mapping. And that's a user interface tool. It comes from there. It's a visualization of an entire end-to-end experience for a generic person or a persona. What does that person go through in order to accomplish whatever this goal is? And whether that's learning about advanced care planning or completing the advanced directives or having a facilitated conversation. What are all of the end-to-end steps that they go through for that? And to look at all of these considerations in that experience. So to map an experience, you can develop, as I said, different personas, and that would be, for example, a patient going through the journey starting as a heart failure patient served by the clinic or specialist. So that's one persona. What would it be like for them? Or the persona of a member of the public who's seeking advanced care planning information. Or the persona of a chronically ill person who's flagged by your system as appropriate for an advanced care planning conversation, and so that is initiated. So those would be examples of different personas, and then for each of them, you want to consider all of these things. Throughout the process, what do they think and feel? What matters about this? What are their worries and concerns, goals or aspirations? What do they see, and what do they hear? What do they need to say and do, the actual steps that they need to take, that patient activation part? And then throughout all of that, what are the pains and gains, frustrations and obstacles, but also benefits to them as they perceive their needs and their wants that get addressed, and whatever your measures of success might be. So empathy mapping can be a great way to consider all of the things we've talked about, all of the pieces and all of these frameworks from the patient's perspective. One other, this is close to empathy mapping, one way to go through it yourself is to go through it yourself, which Joanne Eason is a great champion for doing wellness initiatives in your organization. If you have all of your staff or just the team that works on advanced care planning, but ideally, if you're creating a culture, it would be all of your staff. Give everyone information about advanced care planning and advanced care planning benefits. Offer them the tools that you actually use with patients and families, and have people go through the process. And this does two things. It gives you insight into the process and any hiccups that you have with people or processes or tools. And it also is a benefit to your staff for them to actually be able to express their own wishes and do that earlier, hopefully, in their journey as a human being who at some point will die, and to have those conversations with their family. It's a wonderfully empowering thing to do on many levels, but it's also a way of considering empathy mapping, and that persona would be a staff person, general public. So consider wellness initiatives as a great entree into empathy mapping, and consider using empathy or experience mapping as a tool for all of this. So that brings me to just in wrapping up, I want to remind everyone that as part of the 5 Wishes practice community, you're already using some or many or maybe all of the 5 Wishes program components that you see on this slide here. And if you're not, just know that they exist. If you need help with looking at your processes or the tools that you're using, or how the staff, the people component of your program are prepared in any of the ways that we've talked about, those are all components of the broad 5 Wishes program for healthcare. The whole idea with building a full program is we've considered the things we talked about today, and we want to help you be successful in serving the people that you serve. That is our mission, is to preserve their humanity with you and to empower you to do so. So keep that in mind. And that, Paul, did you have any questions that came through or any thoughts that you would like to offer?
Sure. Well, first I would say thank you, Kathleen, for walking us through all of these considerations. We did have a couple of questions come through that started with the comment that that you were giving us all a lot to think about, and that inspired some people to ask the question, can we go back and listen to this recording and see the slides as a reference? And the answer to that is yes, especially by just clicking on the practice community link that is available on the dashboard in today's presentation or at 5wishes.org. So that information is available. But here's a question, Kathleen, that we sometimes receive from members of our community, the practice community, and that is that they would like to snap their fingers and make all of these things happen tomorrow. And some people may have a full team that they can mobilize to do that, and other people participating in this call might be trying to do all of this on their own. What guidance would you give to the person who says, this looks and sounds all exactly right, but it's a little intimidating because there's a lot there. Where do I start, or can I even start if there's just one of me in this great big healthcare organization?
Absolutely you can, and every program started with one person. I mean, I'm thinking of WellSpan, which has a huge program, but when you talk to Dr. Badia and Roberta about their program and you get the history of it, it started with one person. It started with one champion. What we've talked about today, it is a lot of stuff. And keep in mind that this is the world of possibility that we're talking about. This is the whole world of possibility. This is kind of like, you know, looking at the dream rainbow of how all the things that you can do to have an excellent program. It's not going to start out with all of that. It's usually an iterative process when people build and continue to improve their advanced care planning. Even if it's not a program, it's just activities that you do. But all of these things give you some things to build on. And since this is a community of practitioners, the great thing is you can share your stories with each other. That's a lot of these webinars, which all, by the way, to the question of can we go back and listen to this? Yes. This will be posted on the 5 Wishes practice community page of the 5 Wishes website. There's a link to that on your, right now, if you look under links, there's a link to that page. All the webinars that we've had for the practice community, you can access them on that page. They're all there right now, except for this one, which will be there probably in a few days. But everything else we've done is there. So what we hope to do is, whether you're an individual or a team of 3, or it's just the palliative care department or the chaplaincy department, we're here to help you as you build. So what I hope is that this has been inspiring rather than overwhelming in terms of what we've presented today. That's definitely the intention. And if you need help starting out, that's part of the practice community. Just contact us and we can talk to you. That doesn't cost anything, just having a conversation about what's going on and what you need help with, because we want you to be able to use the tools effectively. So keep that in mind. So yeah, that was the really long answer. The short answer is, yeah, you can absolutely start this as an individual. Every program I've ever seen started with one person who just got it and was the champion. So it sounds like whoever asked that is that person.
Likely so, and a good reminder too. And yes, we've seen great examples play out in healthcare organizations, large and small, in big cities and in rural areas all across the country. So it's great to see that and inspiring to know that it's possible.
And I see some specific questions that just know that all the questions that you're asking, we have. And some of these I may address individually through sending you an email, because they're pretty specific. And so just know we see your questions, even though if we're not talking about them on the webinar, we will get to those in a follow-up. Andrew and Patricia.
Great. Well, I think that brings us about to a wrap, Kathleen. Thank you so much for the experience that you bring to our practice community all the time. We're grateful that at 5 Wishes we can call on members of our community and on the expertise that Kathleen brings from her years of experience in the clinical setting and at the administrative level too, to put all of these things into practice and to give not just the theory and the ideas behind it, but the real world guidance and coaching and laying the path forward. So we're grateful for that. We are here at 5 Wishes and Aging with Dignity for each one of you, for your organizations and the people who you serve. So never hesitate to send us an email, to pick up the phone and give us a call. We're happy to hear from you.